Hi, I'm Joe Calderoni, Senior Vice President for Communications here at Mount Sinai, South Nassau. Welcome to all our Facebook friends. This is a media briefing for our latest Truth in Medicine poll, which is sponsored, by the way, by our good friends at Bethpage. We're very appreciative for their support. We have been doing a series of these public health polls over the course of the last few years in order to try to gauge the response of the people that we're serving in the community and measure whether or not the public education efforts that we've undertaken, especially now during the pandemic, have had an impact. So with me today, to my right, Dr. Rob Sharma, who is the new president of Mount Sinai South Nassau, Dr. Aaron Glatt, who is the chair of the Department of Medicine here at Mount Sinai South Nassau, and also Dana Sandeman, who's our VP for Public Affairs. She's out of the shot right now, but we're going to pan to her shortly. So once again, welcome to everyone. We do have some very exciting results to talk about today. We're going to cover questions about the booster shot, which, by the way, President Biden plans to have a 5 o'clock briefing from the White House, I believe, this evening. So this is certainly very timely, as always. Also, we're going to be covering some issues about masks and mask wearing and mask mandates in schools, which, as you know, is a very hot button topic here on Long Island and really across the state. So I'd like Dana Sandeman right now, if she would, to just take us through some of the results of the poll. And the poll was conducted recently. 600 people in the metro area, both the 5 boroughs and Nassau and Suffolk counties. Dana?
Thank you. So again, this was our first poll since October of 2020. So this is really the first time that we've gauged opinion on coronavirus and the vaccine since late fall, almost a year ago. And the results in almost a year were the change of opinions were really completely different. And I want to just walk through some of the results. Again, as Joe mentioned, our poll is sponsored by Bethpage, our public health partner. Of those surveys, 600 people by both cell phone and landline in the metro area, 75% of those who were already vaccinated, so that group was about 84%, 75% of those say they will get a booster shot if one is offered to them. And you can see in our pie chart here, only 9% said no, 16% were not sure. Are you more likely to get a COVID vaccine now that the FDA has given approval? So this question we asked to that small group of people who were not vaccinated, and 54% said the FDA approval did not mean anything to them. 23% said they were more likely now to get the vaccine, and an additional 23% said they were not sure. Do you think teachers should be required to be vaccinated before the start of the school year? So we really were very timely on this poll. We were in the field about a week before the start of schools here on Long Island. New York City schools are still transitioning in. But 68% of those vaccinated in our area said teachers should be required to be vaccinated before the start of the school year. Only 16% said no, and another 16% said they were not sure. Again, right before the beginning of the school year, there's a lot of conversation going on about kids and masks and teachers and school personnel in the school. Just over 1/2 of those who we polled think kids from kindergarten through 12th grade should be required to wear a mask in school. 23% did not, and 24% were not sure. And this was really interesting. Again, really timely. People had it on their minds about kids in school. And again, you can see the results here on our pie chart. At Mount Sinai South Nassau, we did recently start doing the booster shots for those who were eligible, meeting the CDC guidelines. This was our first patient who was vaccinated with the booster shot at our Vaxmobile. it back over to our panel to just talk a little bit more in depth about the poll results.
So, Dr. Glatt and Dr. Sharma, I know you both have spent a lot of time over the last 20 months of this pandemic trying to educate the public about every variation that's come down the pike. So, one of the main findings of this particular poll was that 75% of those who responded said they would be willing to get the booster once it becomes available for the general public. I think there's some not full understanding about what is currently available. We got people at the Vaxmobile that we run every day asking us, can I get a booster? And in fact, the booster shots are not yet available for the general public. Dr. Glatt, would you just explain that?
Sure. So there are two ideas that people need to understand with these booster shots, and really, booster might be the wrong name. What the FDA has authorized for now is people who really didn't respond to their first 2 doses of the mRNA vaccines, and they didn't have evidence that they had immunity from a laboratory point of view. We're not 100% sure that they don't have any immunity at all, but in that group of patients, there are now studies to suggest that by giving them a 3rd shot, about 50% of those people who didn't mount a laboratory immune response will now have a laboratory evidence of an immune response. So this is for people that have significant underlying immunosuppressive conditions, moderate to severe immunosuppressive conditions. And there are guidelines that are not 100% exact who falls into to these criteria, and that's why there's a little bit of vagueness about this. And in fact, if we now have this information, which we didn't have when the vaccines first came out, we'd actually recommend that these people take 3 doses right away, at time 0, either 3 or 4 weeks afterwards, depending which vaccine they would be taking, and then 28 days after that. So basically at time 0, at 1 month, and at 2 months, those severely, moderately immunocompromised people would benefit from having a 3-dose regimen. We have this type of regimen for other vaccines, and giving that 3rd dose can spur their immune system to mount a better response.
So, Dr. Glatt, who are we actually talking about? Cancer patients? I mean, there's a list to qualify for this.
The CDC has a list that's a not all-inclusive list. They give you examples. So the classical example is somebody that has a solid organ transplant, somebody that received a kidney or a liver or a heart, and they're on significant immunosuppressive therapy to make sure that their body doesn't reject that.
What if I'm on chemo?
So chemo would fall into that category too, depending on whether it's active chemo now or it's chemo in the recent past. If it's chemo 10 years ago, then you would probably not fall into that category.
How about if I got high blood pressure or diabetes?
So these in general fall into a gray zone that a clinician needs to make a decision for that patient. There are data to suggest that a booster shot, which is not exactly the same thing, that's what I'd like to talk about now. The booster shot is for people that did mount an immune response, but because of these underlying conditions, put these people at greater risk if they were to get COVID again. And for those people with some of the conditions that you mentioned, including age, it might be very beneficial to get the 2nd type of booster shot, which is what we would normally call a booster shot, to boost a waning immunity.
So you're saying, best advice, talk to your doctor. If you think you might need a booster shot, really, first stop is talk to your doctor.
So it's important to remember that right now, the official FDA emergency use authorization really talks about the moderately to severely immunocompromised patient.
For the booster?
For what we call the booster shot, but it's really a 3rd shot.
Got it.
The usage of the vaccine outside of that would fall under an off-label usage, and that's something that President Biden will be talking about. That's something that the Advisory Committee on Immunization Practices will be meeting later this month to decide what is the optimal group of patients, if any.
All right, but if I'm a patient and I'm confused, talk to my doctor first?
Always a good idea to talk to your doctor if you're confused about your health.
Dr. Sharma, let me get you in here on this. So, again, just to take a step back, the key finding of the Truth in Medicine poll that we conducted is that 75% of those who responded said, hey, I'm willing to get a booster, and that is much different than a year ago when we did the poll and saw that less than half of the people, or about half of the people, were even willing to take a vaccine. Of course, that was before we even had a vaccine. But I know that in our discussions, you've said that this is a good sign that the education efforts are taking hold somewhat.
Absolutely. The fact that 46% said they would take a vaccine back before there was a vaccine shows that there was some hesitancy, shows that this is unknown area, and people were not comfortable committing to whether they would take the vaccine or not. We've been living now with vaccination since December 14th of 2020, and we've vaccinated over 5 billion people worldwide, hundreds of millions of doses given in the United States alone, almost 400 million. And so what we've seen is that they're extremely safe. We've also seen that they're extremely effective. All of this is information that's been made widely available through multiple outlets and multiple resources, and people are now integrating this information into their decision making. And so where they had no information before, they have plenty of information now. And we're seeing that they're using the information to make a rational decision, which is the vaccines are safe, the vaccines are effective, and if there's a recommendation about a third shot, they're receptive to that concept because they're not concerned about potential harms from a vaccine that they've seen billions of people get and get safely.
And yet we still do have folks who are unvaccinated, and it's kind of a group that it's hard to move the needle, or it seems hard to move the needle with this group.
No pun intended.
And yes, no pun intended. And I imagine that's what President Biden is going to speak to tonight as well. We see it every day among patients and among those folks who come to the Vaxmobile. Let's turn the conversation a little bit to the schools, because one of the findings in the poll is that, again, really showing the split. A little bit more than half of the folks agreed who responded to the poll that students K through 12 should wear a mask, but there was a significant number who believe that they shouldn't be mandated. Although, I believe it was 68%, Dana, that said that teachers should get the vaccine. 68? Right. So speak a little bit about the schools and what we're seeing. Yes, this is the first week of school for many students out there. Parents are still have concerns.
So
talk a little bit about
interesting
that result.
split there. Let's talk about masks first. More than half of the enrolled children in K through 12 cannot get the vaccine yet. They're not eligible yet. And so the only protection we can offer them last year was virtual learning or social distancing within classrooms at half size and hybrid models. We found that methodology of education was truly suboptimal. And the best way to educate children is to do it in a group setting, but you have to do it safely. You can't get 30 kids into a room safely if none of them are wearing masks. And what we're seeing in Florida is a good example of where schools are seeing massive outbreaks when there's no mask requirement. And in fact, they're prevented from having mask requirements by the governor's executive order. The only way to protect our children right now is to have them wear masks. And the inconvenience of wearing a mask is so small relative to the safety that it affords the individual, as well as everyone else in that room. And so it almost seems like a silly point to argue that they shouldn't wear a mask. Would they say they shouldn't wear a helmet or their seatbelt? No one would argue that a kid riding a skateboard shouldn't wear a helmet, or that a kid in a car shouldn't wear a seatbelt. Why would you argue they shouldn't wear a mask when they're in a room with other kids and no one knows everybody's exposure history of who has an active infection that is spreading it? And what we're seeing with Delta, it is highly, highly communicable, meaning it spreads very easily compared to the other variants of coronavirus that we had seen relative to COVID-19. So I don't really see that there's an argument to be made. It's not a personal choice issue. Nobody says it's a personal choice whether to wear a seatbelt or not. This is just nonsense from people who don't seem to understand the importance of the safety that we're affording these children who we don't want sick, who we don't want in the hospital.
And on that point, we are seeing cases of some increasing numbers of young people in our own hospital.
Yes, so we are seeing that younger people are getting more affected by Delta, and we are seeing that it is more likely to result in a significant illness even in younger, healthier people than the previous variants were. So this is concerning. And now we have to worry about what this means for the next variant, which is mu. So we'll talk about that in a minute. But to get back to the 68% who wanted the teachers to get vaccinated, it's a striking contrast that a kid can't wear a mask, but a teacher should get a shot. So it shows that there's a lot of mixed feelings amongst the community about all of these requirements.
Very hot button issue, the masks.
Yeah.
Yes.
And so we need to do a better job on educating our community so they understand. We need to understand from them what their concerns are about these specific issues, so that we can better address the information gaps that exist. Because our biggest challenge is for every piece of information out there that is correct with the science, there's another piece of information that is somebody's opinion.
Yeah.
That is not based on anything other than that person's opinion, but because they're an influencer or because they're in the right in the right media position.
Well, as the late
they get
Senator
hurt.
Daniel Patrick Moynihan famously said, everybody's entitled to their own opinion, but not their own facts. So on the masks, though, just as anecdotally, as parents and grandparents, the kids don't seem to mind the masks.
They don't.
Right?
They don't. Actually, mask compliance, which is highest in children.
Right?
They found no issues with kids wearing masks. There are very, very, very rare health issues that would prevent a child from wearing a mask. And most of those are developmentally delayed children who simply they don't have the wherewithal to comply. And they have challenges with sensory and other issues that might prevent them from being comfortable in the mask. But largely what we've seen is 99% of children can wear masks without any concern.
All right, so you brought up mu. I'm going to turn to Dr. Glatt. This is starting to bubble up now in the popular press. I know you read all the latest data that comes across. Tell us what this is, this latest variant, and is it a real threat?
So I would just open up by saying that we have seen constantly already changes in the COVID-19 virus, SARS-CoV-2. That's what viruses do. They mutate. And this virus, this novel coronavirus, actually mutates a little bit less than some other typical viruses like influenza virus, like the flu virus. That's not necessarily good. That's not necessarily bad. Viruses mutate. And we've seen from the original strain, different strains that come in. And one of the things that makes a strain more likely to take over is how contagious it is. The more contagious a strain is, the more likely it's going to push aside all the competition and become the predominant strain. And we saw this with the alpha strain, and we saw this now with the delta strain, which is probably twice as contagious as the alpha strain, give or take a little bit. It's hard to exactly measure these things. And therefore, delta is essentially the predominant strain in our area, essentially 100%, and close to that across the United States, and in countries where it has been prevalent, it's very rapidly taken over. And whether a strain like mu or whether other variant strains will come in and displace delta will depend upon a number of biological factors in terms of their contagiousness, what advantages they offer to that virus's ability to spread. The fact that a virus is more serious, it's more virulent, doesn't necessarily mean it's going to spread more. Thank God. We wouldn't want that. Sometimes you can actually have a virus that mutates into a less serious, but because it happens to be very contagious, it will push aside a more serious virus.
But is mu here? Should we worry about it?
It is present, but at this point in time, it is not, I want to stress, it's not something that we in the United States right now have as a significant portion of our cases.
And
whether that will change is unknown.
Dr. Sharma, I think you've mentioned that mu may be resistant to the current vaccine.
So the current information available suggests that mu has mutated certain portions that make it harder for it to be detected by our own immune systems, certainly the first line immune systems in the nose and mouth, and also that it is somewhat more resistant to the vaccine's efficacy. We won't know until there's more data, but that's the initial sense right now. As Dr. Glatt mentioned, there's not a lot of mu cases, so the data is only now beginning to be gathered in this country, as well as other countries where that may be more prevalent.
I know I've heard you both say, I believe, that this is the idea that there are variants and that Delta is one, we're going to see others, is all the more reason to get as many people vaccinated as possible so that the virus runs out of places to go. Would you explain the vector, how that works?
So viruses cannot survive outside of a host. They will, unfortunately, survive very well inside a host, and we are the host. So if everybody theoretically was immune to the virus cannot spread. That's the reason to get vaccinated. The more people that get vaccinated, the less places this virus will be able to propagate and spread and further go and mutate and then be able to attack people that previously were immune. So that's why it's more critical than ever. People read mistakenly that, the vaccines don't work as well against the Delta variant as they may have worked against some of the earlier variants. And that is true, but it's a non sequitur. It doesn't change anything. Serious illness, fortunately, is still greatly protected by the vaccines. And the fact that somebody is less likely to get it, therefore they're less likely to spread it, is the real benefit to society by getting as many people as possible vaccinated. And that's why I think the FDA approval for that small group is going to make a difference. We've had people come to us and ask us, well, I didn't want to take this vaccine when it was an emergency use authorization, but now that it's FDA approved, I'm willing to take it. Now, whatever the reason is that people are now switching from being unwilling to take the vaccine to willing to take the vaccine, that's tremendous, because this is good for themselves, for their family, and for society at large.
Let's get to some questions, and a reminder to our Facebook audience, please do post your questions. We are going to have time to entertain them, and in fact, we'll get to one right now. Dr. Sharma, we know that Pfizer received final approval from the FDA. What about J&J? And will the J&J, if I had J&J, am I eligible for a booster? Do I need a booster?
So the recommendation is that if you got any of the vaccines and you fit into the criteria that Dr. Glatt described as immunocompromised, that your series should include an additional shot. So
of the same vaccine that you got?
Yes.
So for the J&J that hasn't been officially, I think what Dr. Sharma said is correct, but that's not what the FDA authorization has said for the J&J, because J&J came out later and there's just not enough information about it. But I agree with the concept 100%.
So the issue with the J&J is because Pfizer has been approved, it came out much earlier. There was much more data for the FDA to evaluate. We don't have those answers on the J&J vaccine yet, because not only did it come out later, it certainly had less penetration in terms of how many people got the J&J. So just even the number of people to do the studies on is lower, and the FDA requires large amounts of data for these final approvals. And so doing the studies and making sure you can enroll qualified people, et cetera, it does take time.
So if I got the J&J or if I got Moderna, can I get a booster that's Pfizer?
So that's a tricky question. The CDC did give guidance earlier that the vaccines, if you ran out of Moderna and you only had Pfizer, somebody got one shot, you could give it, vice versa. J&J is only one shot to begin with. But the recommendation is to get the shot that you had already gotten.
Stick with what your original vaccine was.
But as Dr. Sharma said, if you aren't able to get that original dose, or you don't know for whatever the reason what your original dose was, or people that come sometimes from a different country and got a vaccine of unclear what its value is, so then you can get a different dose. They do recommend at the present time try to keep, if you're getting the mRNA vaccines, to get the third one the same as your first two, but it's not an absolute.
Okay, here's a very basic question from one of our Facebook followers. Dr. Sharma, should I socialize with those who are unvaccinated?
It's not for us to tell people who they should socialize with, but certainly what we should all be responsible for is our own personal safety. And there are risk stratification to any activity we do, whether that's dining indoors versus dining outdoors. So for example, my family and I, we dine outdoors. We don't dine indoors because that's been shown to be a high risk of exposure when in contact tracing. It's one of the highest risks of exposures. Socializing with people who are unvaccinated, what does that mean? Does that mean you're sitting in your backyard around a fire pit, they're on one side, you're on the other? Probably no harm in that. Does that mean they're inside your house, staying with you for 3 days? That's a different kind of a risk. So each situation has to be evaluated. Ideally, we try to protect ourselves at the same time, not depriving ourselves of all of the inputs we need in life to make life worth living, which includes our social interactions. So there has to be a balance here, and people have to make choices that are going to do the best that they can to balance their family safety and their personal safety with those socialization elements.
So, I mean, we're seeing Broadway reopen. We're seeing the NFL come back this week, college football. Stadiums are filling up. If you're going to one of those events, what's your recommendation?
So I was watching the U.S. Open, and they have finally allowed all the seats to be filled for the semifinals, quarterfinals, and they're all cheering and screaming, and it's an extremely aerosolizing event when we sing, scream, cheer, and so the exposure rates are going to be high. New York requires you to have a negative test or be vaccinated to get into these indoor venues, so that's protective to some extent. If you don't have an area where that's requirement, then wearing a mask in these scenarios is probably your best bet if you choose to participate. Some people will choose not to participate until such a time that it's safer. And again, these are all personal decisions that you balance your safety versus against all the things you need to enjoy life.
So let's switch gears a little bit back to the vaccine and vaccine mandates, another hot button issue. More and more employers, Wall Street employers, other employers are requiring you to be vaccinated if you want to return to work. A lot of companies are still remote, but we're seeing people start to come back to work.
Right.
It's been 20 months now. Remote helped in the beginning, but I don't think we can live remotely forever. So what do you think about the employer mandated stand up in court?
Well, two questions there. Employers are in a tough spot because they want to do whatever they can to safeguard their employees. You don't want to bring them to a workplace for them only to get sick and then sicken their home family members as well as other employees. So it's a tough spot for employers. I think doing whatever they can to safeguard their employees is always a reasonable approach. And as long as they make options available for their work from home contingent when possible, I think that's a good balance. With regards to, what was the second part of your question?
Whether or not you think it'll be legal, whether it'll stand up in court.
So the EEOC did come out with an opinion, and this is federal, prior to the vaccine, saying that an employer could mandate a vaccine to be required for work, that they felt that it was not unconstitutional, that it didn't violate anybody's rights, because the employer is trying to safeguard their environment, and the individual does not have to work there if they choose not to. So they have the option to walk away. So they did. I do think it'll stand up in court. The number of court challenges we've seen so far, there was one in Texas that was upheld for the Methodist hospital system. So I don't see the court challenges are going to be successful against this mandate because it doesn't infringe on individual rights. It simply makes a requirement for employment, and employers have absolute requirement. They could require you have skill set a certain degree, or they could require that you wear a certain uniform, and all those requirements fall into the same category, and the federal government has determined that is consistent with the current practices.
Dr. Glatt, this is a question from one of our Facebook followers. Thank you for those. Keep them coming. So in our own hospital here at Mount Sinai, South Nassau, and Oceanside, are we seeing patients who receive the vaccine early, like December and January? Are we seeing any patients who were fully vaccinated who are now coming to the hospital with so-called breakthrough cases?
So breakthrough cases are being seen, but most of the time, the vast majority of the time, they don't lead to hospitalizations. And an extremely small percentage, even those that are hospitalized, get serious illness. In our hospital today, 17 of the 19 patients in the hospital, because of COVID, have not fully received their vaccination. And those numbers are across the United States. The deaths in the United States from COVID are 99% plus in the unvaccinated group of people. And this is, I think, the best and most important reason. We're seeing more and more hospitalizations, as we talked about, in younger children. We're seeing more and more hospitalizations in the 30 to 39 age bracket, which previously was very unusual. So Delta clearly is not only more contagious. A paper just published in The Lancet, some other papers suggest that it's more virulent, meaning it's a more serious type of a virus. And again, the vaccinated people can get a breakthrough, but they usually don't get very sick. And if they do get sick, they don't get very, very sick. And unfortunately, the same cannot be said for the unvaccinated, who are more likely to get sick from Delta than they were from the previous variants, and heaven forbid, more likely to require an ICU visit, to have a tube put down them to breathe, and the worst possible outcome is death. That's the group of patients in the United States right now that are having serious COVID complications, unvaccinated people.
And we've seen younger patients, unfortunately. We've seen
unfortunately, yes.
30 and under.
Across the country, that's the fastest growing group, is the 30 to 39 group. The morbidity and mortality weekly report just published last week, increased hospitalizations, increased cases in younger children, and much more so than previously. Now, thank God it's still a relatively small number. I don't want to scare people unnecessarily, but if your child is eligible for a vaccine because they're 12 years old or up, I would get it done as soon as you possibly could if they haven't been vaccinated yet. And I think the data shows that now we're, in many situations, well above 50% of that group already being vaccinated. And I think parents who really don't want to take the chance with their children getting sick, as opposed to saying, I don't want to take a chance with a vaccine, there's really very little reason to think that the vaccine is dangerous in these children. There's a lot of reason to think that COVID is dangerous in these children. And I also point out that long COVID, the long-term consequences of COVID, are seen in younger children who had mild illness. Not all of them by any means, but a significant small percentage of them have persistent symptoms. And that's another good reason to get vaccinated.
Dr. Sharma, we do have a member of the press here, so I'm going to turn to him in a second if he has any questions. But in the meanwhile, I know one of the groups that is kind of reluctant, some of them, not all of them, are women of childbearing age. It's a kind of a special category, people who are trying to get pregnant, who are pregnant. They still have some reluctance among some of that group. Talk about that and whether or not you recommend the vaccine for those who are pregnant or who are about to get pregnant or trying to get pregnant.
So that's a challenging area. The science that we have available so far show us that pregnancy itself is actually a risk factor for complications associated with COVID infection. And if you're pregnant and then get infected with COVID, you're much more likely to have preterm labor, complications associated with pregnancy requiring ICU, critical care admission, and even the death rate is higher. So this is something that's very concerning. So yes, we do recommend that pregnant women get vaccinated because they're now in the high-risk group. When it comes,
the CDC has recommended that.
That's the American College of Obstetrics and Gynecology, the Society for Maternal Fetal Medicine, the American Academy of Pediatrics, and the CDC. Every major group.
All of those experts have recommended that pregnant women get the vaccine.
That's correct.
Right.
With regards to childbearing, the challenge I think some women have is that the vaccines have only been out since December. And so we don't have true long-term data. So for them, that's the question mark. The problem is this, is that the only way we eradicated smallpox was by getting the entire world vaccinated, and now that virus doesn't exist anymore. If we continue to have pools of people where there's no vaccine, no vaccination, this virus will continue to proliferate, will continue to mutate, and who knows what we'll end up with down the road. What we're seeing is each variant seems worse than the one before it. So clearly, the mutations are helping this virus figure out ways to stay active. We need everybody to get vaccinated. We haven't seen anything to suggest that there are any concerns with reproductive health or with children who are born in mothers who are vaccinated. We're not seeing anything. We don't have the long-term studies that it may take to make some people feel comfortable, but we all have to do our part to stop this pandemic.
And in fact, what we have seen is if you are pregnant and you get COVID, that can be trouble.
Yes.
Right.
The most recent paper that was published in JAMA, a major journal, showed that women who are pregnant and got COVID had a 15 times more likely chance of dying than the same group of women who didn't have COVID. So this is a phenomenally scary and important risk factor. The vaccine has also been studied in pregnancy now and published in the New England Journal of Medicine, clearly showing no increased risk of any medical problem with the vaccine in pregnancy. So on one hand, you have now a vaccine that's been shown to be safe in pregnancy. You have a disease that's shown to be very dangerous in pregnancy. We have a long history of vaccinating pregnant women. Very good results. To me, you're taking a tremendous risk if you're pregnant or wanting to become pregnant and taking the risk of getting COVID and having a bad outcome on your baby, bad outcome on yourself, versus a theoretical concern which the studies to date have clearly shown is not a real concern during the period of time that we've had this vaccine available in pregnancy.
Do you have any questions?
Sure.
Member of the press.
In covering the...
Just identify yourself, please.
Sure. Tom Krozik from the Rockland Center and Oceanside Herald. Covering the school board meetings, I see a lot of the people that don't want the mask mandate in schools. They say, you know, why can't I choose not to and other people can choose to? Obviously, you know, that's not how it works. But can you explain to those people why that can't be the case when you're trying to shut off the disease?
Absolutely. I go back to the analogies I gave. Would they not put their child in a car seat? Is that an option for adults? That's not an option, right? If you don't put your child in a car seat, you get a ticket, and you can even maybe get a visit from CPS if you do it too often. So, you know, this is not one of these issues that is truly optional if we're looking at protecting a vulnerable population that can't be vaccinated, and kids, you know, they're on top of each other, right? So this is important that they wear masks. And what we're seeing in the states that don't have the mask mandates, where they have prohibitions on mask mandates, are the highest numbers of COVID, and especially the highest number of COVID in children. Florida has the highest rate of childhood hospitalizations for COVID right now in the country. That's unacceptable, unavoidable, and preventable. So I would ask any parent who's thinking that it's an issue of choice, why would you not want to protect your child? Why would you not want to protect your child's classmates from COVID? What would the rationale be? What's the harm in wearing a mask? Would you put a helmet on your child if they were skateboarding or riding a bicycle? Would you put your child in a seat in a child safety seat? If you say yes to those answers, you can't rationally say no to a mask. It becomes an emotional response that's not based on logic.
And also, we clearly require, now we require students to be vaccinated for other diseases in order to enter school, right?
That's correct.
Measles, mumps?
Measles, mumps, all of the required vaccinations to be active matriculating in the school. They safeguard us against outbreaks. We've seen so many diseases eradicated practically up until this whole concept of vaccine hesitancy came up. We didn't see measles the way we used to see it. Measles was a common cause of all sorts of horrific diseases, especially congenital disorders associated with congenital rubella and other things that we saw the MMR eradicate. Childhood deafness, meningitis. We've seen so many diseases that used to trouble and plague our children essentially disappear because of vaccinations. And this concept that it's somehow harming them, this concept that it's somehow bad for them, is so contrary to every piece of data that's out there. And so people cling to misinformation. They cling to, there was a published study that was completely false on vaccines and autism, and they cling to that even though it's been completely disproven. The person admitted he lied about everything in the study, but people will still cite that study as if it's a scientifically sound study. It's not.
Any follow-up question, or you good?
Sure. Yeah, would you advise people not to travel again, kind of like a few months ago during?
So I think the challenge is this. From a global perspective, there are certain economic things that we have to do to keep the countries and and these nations and their economies running. Leisure travel is probably the easiest sacrifice we can make to try to reduce the spread, right? So is it advisable to travel if you're vaccinated and you follow safeguard guidelines? I think if you want to travel and you need to travel, that's a different story. Everybody has to make a personal decision. You know, if you ask me what we're doing, my family, we're only traveling by car, places we can go by car. So this past February, we drove to Florida, right? That's what we did. We practiced safely when we were there. We ate outdoors, easy to do in Florida. And we came home by car as well. Our son youngest child wasn't vaccinated at that time, and we didn't want to expose him unnecessarily if we could avoid it. Having said that, there are certain elements to keeping the economies open and there are a lot of countries and states that rely on tourism. When the governor of Hawaii says don't come, what does that tell you? How bad has it gotten in Hawaii that a state that relies heavily on tourism, the governor is saying don't come? It tells you how important it is that we kind of try to stay in our local environments to try to reduce the spread as much as possible.
Until everybody gets vaccinated.
Until everybody gets vaccinated.
All right, so one last question from our Facebook fans out there, and thank you again for sending them in. We appreciate it. If I had COVID, do I have natural immunity, and is it as effective as the vaccine? Dr. Glatt.
Okay, so this is an area where we're getting new information every day. So I think that the likelihood of a person getting a second episode of COVID after they had a first episode of COVID is low. How low and how long still remains unknown. I think the evidence from published data suggests that in the first 90 days it's unheard of, and even in the first 6 months it's extremely unlikely. Now, how much beyond that? There are some studies that suggest that it can last significantly beyond that as well and provides natural immunity. But a person shouldn't rely upon that to not get vaccinated. So the boost that you get with a vaccine has clearly been shown. In patients who have had COVID, their numbers skyrocket after they get a vaccine, after they have had COVID. So the current recommendation from the CDC is that even though you've had COVID, you should get vaccinated. And I think that the risks of getting vaccinated are so small and the benefits are potentially so significant. Again, many of the people that had COVID a year ago, 18 months ago, it's unclear how good their immunity will be against Delta. And there are conflicting studies. There is a published paper, again, by the CDC in the Morbidity and Mortality Weekly Report that suggested that those that had natural immunity, they had COVID, were not as well protected as those that had the vaccine. There are other papers, suggestions that may not be as clear. So the message that I would give to people right now is if you've had COVID recently, you don't need to rush to go get a vaccine, certainly within the first 90 days, probably even up to 6 months. But beyond that, I strongly recommend that people get vaccinated even though they had COVID. I think that's clearly the safer option, in my opinion.
All right, I'm going to thank everyone. Thank Dr. Glatt and Dr. Sharma for taking the time to do this. These have been very informative throughout our 20 months of the pandemic. I'm going to end on a note that if you need a vaccine, the Vaxmobile today is open until what time, Dana?
4 o'clock.
4 o'clock. We're at Grand Avenue and Sunrise Highway, and we're going to be doing it inside because, of course, it is raining today. So no appointment necessary. It's free. Come on down. Bring your friends. Bring your relatives. Get vaccinated. It's the best way to combat this virus. And I want to thank Beth Page, Federal Credit Union, for sponsoring the Truth in Medicine poll, and thank our Facebook audience for tuning in. Thank you, and we'll see you next time.